Hi, I'm Linda Vignapiano. I'm the clinical manager for Sher Institutes. I'm based at our clinic here in Las Vegas. I'm going on my 15th year with the company now. And today, what I want to share with you in this video is kind of a nice overview of what to expect. You might hear this video referred to as the chart review video. It's actually kind of what I call the what next video, because I'm going to try to cover a lot of what do we do next, because that's going to be your question almost throughout this whole process. Well, I've done this, what do we do next? Well, I'm comfortable with what I've learned now, but I don't know where we go from here, that kind of thing. And that's kind of be your theme, even going through the cycle. So that's kind of what I want to cover now. You're going to be, as you sign up for a cycle here with our Las Vegas office, you're going to be getting, having specific appointments, consultation appointments with the office manager to go over the financial costs, the different plans we have, different insurance situations. You'll have an appointment with your coordinator, which is what I am. You'll have certainly an appointment with your doctor. But along the way, and even through your cycle, you're always going to wonder about what's coming up next. And me personally, I always like to know what's coming up next. It kind of lets me get ready for things. And I like the idea of this video being part of your repertoire of information, because throughout your cycle, I want you to be able to refer back to this to say, I remember watching that video Linda did a couple of months ago and she talked about this. Well, now you can review it, and you can review it at your own luxury and with your partner in your home, etc., and just keep kind of reminding yourself about how things go. So that's what this is, the what's next video. Now, so let's see, where are you at now? Probably you have had your consultation with the doctor, probably have gotten all kinds of information, more information than you ever hoped to get, and you're trying to sift through that, and you're out there on the internet, you're Googling, and you're trying to learn all kinds of stuff, and you might have gotten all kinds of attachments in an email or just all kinds of things to help explain maybe how the doctor interprets your situation, what he thinks might be going on with you, treatments, ideas he might be having about treatment for you. So you've gotten a lot of clinical information. Now also in the beginning, you should be having an appointment also set up with the office manager. Now that appointment's important because unfortunately, you got to have that whole other piece of the puzzle. How much is this going to cost? What are my choices? Do you have any information on financing? This kind of stuff. Do you think my insurance might cover anything? Well, the office manager is going to have a consultation that's geared towards all of that. We try to keep the financial information and the clinical information separate, just because, as the clinical person, I like to just focus on the clinical stuff. I don't want to get too involved in the financial side of things. However, I'm certainly familiar with our plans and can help talk about that with you and what might be best for you in the long run. But like I said, you will have dedicated people talking about these different subjects with you. So once you've had the financial information, now again, not that that's as critical to decide which way, what kind of plan. More important is, do we want to go forward? Do we want to do IVF? And at that point, when you do make that decision, then you get what we call a chart review appointment with your clinical coordinator. And that's kind of what I want to go over today, because when I have a chart review appointment with a patient, like I said, this poor soul has been overloaded with all kinds of clinical information, usually very much to their pleasure. I mean, they like learning a lot more about, usually you've had a couple of failed IVFs elsewhere and you've just learned a lot more about yourself. So again, they've got a lot of good information. They've gotten all the financial, they've decided, I'm doing it, let's move forward. And now here comes the really big, appointment to talk about all of the what next. So that's generally what I try to go over with everybody at that appointment. So we're cheating, and I want to go over it with you now because, again, I want you to have this information. And a lot of people don't want to commit to deciding I'm coming there for a cycle without knowing how to do this. Now, when I say coming here for a cycle, the reason I say that is because here in our Las Vegas office, most people do travel to come see us. Of course, I do have my share of locals, absolutely. But again, I'd say the lion's share of our patients travel. They travel from all around the country. They travel from all around the world. So we have got experience. I deal every day with patients that don't live here. So I know you might not be comfortable with how we do this, how it's arranged. Where do I get things? How do things go down? I'm not even there. I don't even get to meet you. How do I know your address isn't an empty lot when I get to Las Vegas? And yeah, I've had a couple husbands ask about that. We're not an empty lot, we're real. But the reality is, I want to be able to, help you understand all that. We're perfectly comfortable. We do it every day, and I want you to be comfortable, and I want you to know it's a lot easier than you think it is. Now, let's go from the beginning. Like I said, you've had your consult with the doctor. You've probably already had your consult with the office manager to get all the financial info. Now, one of the things that'll come up is how we do our IVF cycles. We do have pre-planned cycle dates all year round. These are all laid out in advance. For example, I might say, geez, our upcoming cycle dates are June 17th, August 5th, September 26th. I'm just making up. These are dates that are coming up with cycles. They're all pre-planned, and when you speak with the office manager, she'll be able to let you know what the pre-planned cycle dates are. This way, we are able, because again, most of you coming here, we've got to kind of pre-plan this. We've got to make arrangements with work, with travel and flights and all of that. So we do our cycles in advance, the dates planned, so that we can make all of these arrangements. Now, I'm going to use, and I've got a sample of a calendar here, a medication calendar, just because it helps me to actually look at a physical calendar when I'm talking about things. My example is our June 17th cycle. We've got a cycle coming up June 17th, and I'm going to use that as an example. But regardless of what date, again, we have another cycle August 5th, etc. Those dates, we call them cycle day 9 dates. Not because it's the 9th day of your cycle. That's really just a label, but you'll often hear that label thrown out. What's your next cycle day 9? What are the cycle day 9 dates for the year? That's just a label. That date represents your first follicle monitoring appointment here in Las Vegas. So I'm going to use June 17th as our example. And on this calendar, which you might be able to see a little bit here, it's a little pretty colorized medication calendar, and I don't want you to think at this appointment you need to try to get from me what all of these drugs are about and how we do all of these drugs. I actually have on our website injection instruction videos where I talk about the drugs. I actually show you how to do the injections. When you have your coordination appointment, you get written medication instructions that talks about all the drugs in detail. So that really isn't what today is about. Instead, I want to talk in general about how we do this IVF. Again, you can get the drug info elsewhere. But you get one of these little colorized medication calendars, and when you get it, it always looks like it ends on the day of your cycle. In this case, if somebody were coming for the June 17th cycle, it looks like the calendar ends on June 17th. Well, in actuality, this version of it ends on June 17th because that is your first appointment here in Las Vegas to start those ultrasound appointments with your doctor. You've already been on your injectable fertility drugs. They're at home for 6 or 7 days. And what's going to start on June 17th, or whatever your cycle date of choice is you're going to start doing the ultrasounds to count and measure the follicles. And if you've done IVF or even IUIs before, you know what I'm talking about. Those are ultrasounds to see how you're doing, to see how you're responding to the drugs. Now, I'm going to cut to a piece real quick that I know a lot of you have questions about. Again, a lot of you, and most of my patients, have experience with IVFs and IUIs even, and they'll want to know, well, geez, I'm not coming to see the doctor until after 6 or 7 days. That seems an awfully long time to go without monitoring. Maybe I need to get monitored here at home or what have you. And the answer to that is no, you don't. Our protocols are set up such that you are downregulated with Lupron earlier in advance on a long Lupron protocol so that your hormones are under complete control. The way our stimulation protocols work, you're not going to need to be ready for ovulation or trigger shot sooner than 7 days. Not going to happen. Physically, you're not going to grow follicles fast enough. As a matter of fact, out of about 30 patients that come in on June 17th, probably 1 will be ready, meaning her follicles will be large enough. And unfortunately, I need to see everybody just because of this one gal who'll be ready. So again, you're not going to be ready sooner than 7 days. So I don't need to see you for the risk of, gee, I might ovulate before then. Sometimes folks are, again, from their previous experience, They're used to, maybe you need to fix my drug dose. Maybe you might need to increase it or decrease it. Again, our protocols are set such that, like in real life, your FSH level, dose, if you will, is a little bit higher in the first few days of your cycle. Then it drops down to more of a cruising dose. To try to monitor you after 4 or 5 days of already being on these doses. If, for example, I didn't like the way you were responding, maybe I didn't have many follicles growing, I only had a small handful. For me to try to increase the dose at that point, granted, even if I could bring on more follicles, they would be growing all out of sync with the first batch. That wouldn't do anybody any good. And if I thought you were doing too much, growing too many follicles, for me to cut down on the dose wouldn't necessarily make all those follicles go away. So the point is, we don't play with the drug doses. Just doesn't happen. So if I'm not going to play with the drug doses after 4 or 5 days and you're not going to be ready to ovulate, it would be a waste of your time, and especially since most of you are traveling here, to have you here in Las Vegas during that time. There'd be no point of that. So again, you're going to be on those stimulation drugs for 6 or 7 days before we start monitoring you on that cycle day, June 17th here in our example. Now, so what started happening on June 17th? Well, for any one person, I don't know exactly how this happens because it always depends on your body. But you're going to spend maybe the next 2, 3, 4 days doing these ultrasounds. Now, you might come in every day. Doctor might have you come in every other day. Again, we're watching the follicles grow. Now, again, after maybe 2 or 3, 4 days, eventually those lead follicles are going to be big enough in that 18 to 20 millimeter range. And the doctor's going to say to you, all right, you are ready for your Hcg trigger shot tonight. And for some of you who have already done IUI and IVF, that sounds familiar to you. Now, what that Hcg trigger shot does, that helps mature up the eggs in the follicle, helps loosen them up, helps get them ready for the egg retrieval. Specifically, what it'll also do for you and I is it'll help us plan the egg retrieval. Basically, the egg retrieval is 2 days later. So in our sample calendar here, which is when I send you your specific calendar, I always have written on here, probable Hcg injection, meaning probably around Wednesday or Thursday. I should say most of my patients will be getting their trigger shots. Now, I always have a couple gals who are going to go early and get a trigger shot on Monday or Tuesday. And of course, I have a couple of gals that are going to go longer, and maybe not until Friday or Saturday or Sunday are they going to get their trigger shot. But in my little bell curve of what's normal, probably most of my trigger shots are happening midweek around Wednesday, Thursday-ish. So that way I'm able to give both you and your partner 2 days notice of when you're going to have the egg retrieval. Now, the egg retrieval happens right here in the clinic. We have a little OR here. The doctor does use an anesthesiologist, so you are getting an IV anesthesia, propofol. That means you're going to take about a 15-minute nap for the egg retrieval, right? Very pleasant, probably best nap you've had in a while. And at this retrieval, while you're sleeping, the doctor is going to empty every follicle you've grown. Now, for those of you who haven't had an egg retrieval before, there's no cutting or stitching or anything like that. It is just a needle. However, it is a needle that goes through the vaginal wall up to each ovary, so it's not anything you'd want to be awake for. But again, it's not anything that's horribly invasive. Takes about 15 minutes to have an egg retrieval. Like I said, you're asleep with that, but you wake up real quick and you'll recover here in the clinic for about an hour, just kind of sleeping it off. Definitely want that egg retrieval day to be a down day for you. So if you're a local gal, working, etc., I would definitely tell you that's a day off for you. And if you're somebody who traveled here, well, that's not a day you're going out shopping. That's when your partner is going to be going out and getting you some good food and bringing it to you, and you're just going to kind of be a couch potato that day. Now, speaking of your partner, the day of your egg retrieval is also your partner's official appointment day. He is welcome anytime that you're being seen, certainly, but sometimes the partners can't always be here that length of time. Sometimes they're flying in and flying out, and I got to cut it shorter when they're here. And that's okay. We can do that. Again, most egg retrievals will happen around Friday or Saturday. Again, I'm going to have some early, maybe Wednesday, Thursday, and I'm going to have some late, maybe Sunday, Monday. But most of the retrievals will happen around Friday, Saturday. But I'll always be able to give you 2 days notice. Now, on the day of your retrieval, when you go in for the retrieval, we've got a little room here for the guys. He'll go do his semen sample at that point. Now, for those who have, nervous or shy partners, certainly we can talk about just sending you back to your home or hotel with a little specimen cup in a bag if that's easier for him and more comfortable. We'll talk about that when you're here, but that's an option. Now, like I said, doctors emptying every follicle you grew. Now, again, for those of you who have experience, but I'll repeat it for those who have, but even for those who don't especially, there's always a natural attrition rate that occurs in IVF. So I'm going to introduce that concept now, because as you're coming in and having those ultrasounds every day, every other day, you're hearing the doctor talk about follicles. You're growing follicles. Now, how many follicles do you have? Well, it depends. What's your age? What's your hormone levels on day 3, your AMH levels? These are the kind of things that probably gave us a little bit of a clue as to how your ovaries will respond. Maybe 12 to 15 follicles is a nice range, a nice average range. Certainly, I've got some women who have certainly, less follicles than that, and then I'm going to have gals that obviously will have more follicles than that. But let's just go with 12. It's a nice average number of follicles. Now, when you're growing these follicles and the doctor's measuring them, you've got all kind of measurements. You've got, and I like to see the follicles get to maybe that 18 to 20 millimeter range. We call those, getting to the point that you're getting close to being ready for that trigger shot. But you're going to have a couple of 16s and a couple of 15s and a couple of 14s and all that kind of, and that's just the ovary is growing follicles, and the method it's growing follicles. I wish they could all be 20s, but that's not the way it works. So you're going to go to that egg retrieval, and like I said, the doctor's going to empty all those follicles for you, and we're going to learn at the egg retrieval, how do we do? How many eggs did we get? And right off the bat, we're probably going to have the first attrition rate, sign of the attrition, where you're going to have, I went in with 12 follicles, but I came out with only 10 mature eggs. I had a couple of immature eggs. Sure, absolutely, because remember, he's emptying even those little follicles that you grew. So there's going to be some immature eggs there. But that's where we start to have our first little drop down of things. Because again, sometimes, and I don't have it very often that I get newbie people at IVF, but they hear about how people had 20 eggs and they just automatically assume that means 20 babies frozen in the bank. And certainly, of course, that's not how IVF really works. So again, I might have 12 follicles that leads to 10 mature eggs. Now, what are we going to do? Well, on the day of that retrieval, we've got those, in this case, 10 mature eggs. Partner's given us a semen sample. Later that day, embryology is going to do what's called Hcg. That's where they inject one sperm into each mature egg. And we're going to let them do their thing overnight. This is where nature comes in. This is, horse to water thing. You can put a sperm in an egg, but you can't make it fertilize. That's just up to those two to do together. And that's what will happen the evening of the egg retrieval. We will learn the next day. We'll take a look to see how we did, and we're going to learn how many of those, in our example, 10 mature eggs that we did sperm injection on, how many of them fertilized. And we may learn the next day that 8 of them fertilized. Again, not all of the eggs we inject with sperm are going to fertilize. So in our example now, we went from 12 to 10, now we're at 8 fertilized eggs. Now you're waiting. Okay, now you've got a big wait from egg retrieval until the next time I need to see you, which is embryo transfer. Now you've got that's about a 5 to 6 day wait, because, of course, we prefer to transfer embryos when they make it to that expanded blastocyst stage. Now, you'll hear along the way, and you'll get some updates too as we're watching the embryos grow. Again, we got that stage of they're fertilized, and then we're going to get to day 3, and we're going to talk about how they look and how are they growing. We're going to talk about how many cells they are. I like to see between 6 and 8 cells on day 3. Day 3 is not a hard place to get to. Even old gals like me can get to day 3. You can make those embryos. That's not hard. What starts to get difficult for these little guys is making it out to that blastocyst stage, because after day 3, we just start talking about embryos in more of their developmental fashion. Are they compacted yet? That's the next stage after day 3. After they've compacted, they start to make it to an early blastocyst stage. And after that, they make it to this beautiful expanded blastocyst stage. That stage happens somewhere between day 5 and day 6. Now, Mother Nature isn't going to let all of these, what do we have in our example, 8? Not all 8 of them are going to make it to expanded blastocyst. No. Of course, we know as women, most of our eggs are abnormal, so Mother Nature is going to cull out most of the abnormal ones right then. Now, how many of our 8 can I expect to be expanded blastocysts? Well, the answer to that question is a question I'd ask you, how old are you? because that's what's going to help me answer that. Younger gals, egg donor situations, you might see half of those good-looking day 3 embryos make it out to blastocysts. So I could end up maybe having 4 blastocysts in that cycle. If I'm closer to 40, if I'm over 40, I might get 1 or 2 making it to that blastocyst stage. So it all depends, of course, on your age and what the quality of those eggs are. But we're going to get to that blastocyst stage on day 5 or 6. And then, of course, we're going to talk about doing our last step, which is embryo transfer. Now, again, remember, you came in on that Monday. Our example, we were talking about coming in on June 17th. We talked about during the first week, we're doing ultrasounds, probably hitting egg retrieval around the weekend. Now we're in the second week of cycle. Embryo transfer most likely is going to fall probably in the, I'm going to say the mid to the latter end of the second week. Embryo transfer happens right here in the clinic as well. Well, certainly at the time of transfer, we're going to talk with you about exactly what the embryos look like, how many we have, how many is the doctor recommending for transfer. We always do our embryo transfers under ultrasound guidance. That way the doctor can see exactly where that little catheter is going through the cervix into the uterus, so we can see exactly where we're putting those little babies back. You'll lay here in the clinic for about an hour. We give you a little Valium ahead of time so you can be nice and relaxed. Transfer isn't anything that's uncomfortable. It's, for us females, we know what a speculum is like. It's not pleasant, but I mean, it's not anything that I need to be drugged for. But again, the Valium is because you're going to be laying here for an hour afterwards, so we want you to be comfortable. Now, once we do the embryo transfer, it's important for you to know, embryos are never going to fall out of you. I know a lot of my patients ask, well, now, how long am I going to need to be on bed rest after this? Well, pretty much it's our policy here. You just need to be a couch potato overnight. And again, that's probably even overkill, because the reality is when you want to know what to expect or what should I do or what shouldn't I do, you know what? Look out there. Look out there and see what Mother Nature really does do. Because at this point, when we transfer embryos back into your uterus, they are sitting in your uterus just as though Mother Nature put them there. I know that's not how it went down, but it's the same principle. Your body is out of your control. Your body is going to do with them whatever is meant to be. They're going to implant or they're not right there. You could do cartwheels exiting the clinic if you wanted to. And the reality is, if there was some trick to unimpregnate yourself, I tell my patients all the time, every teenager in the world would be onto it. And the reality is, it's not. So with that, my biggest message is after embryo transfer is, don't stress, don't worry. When I say don't worry, don't act like or don't believe you've got some power over this. If you take 3 steps to get up into the house, oh, that's it, I blew the whole thing. No, not at all. When I tell you it's out of your hands, I truly mean it is out of your hands. So you let go a little bit, okay? Because I like, if nothing else, to try to keep as much of that. You're going to be, you're moving along here with this stress level that's already here. Can't make the stress go away, but I certainly don't need to increase it. And that's important. To me, that's important after embryo transfer. So most folks, I would say, and again, so you can travel home the day after embryo transfer. That roughly is putting you here in Las Vegas for about a 10 to 12 day stay, okay? Again, you start out on Monday, the first start of your cycle. You're probably going to be ready to be traveling home, like I say, about 12 days later on that Saturday, which is like the second Saturday of cycle. Now, you might be able to leave sooner than that if you moved quickly. I even have a couple gals that have to go later than that. Certainly, I'll know that kind of thing in advance if you have to change reservations or what have you. But roughly, that's what you're looking at. You're looking at being here for about 10 to 12 days. Now, while you're here in the office, we do kind of primary care. That's what we do here, believe it or not. Most clinics do not. Most clinics are, you need to call and talk to the nurse. You have a question, well, you're going to go to the nurse's hotline, the nurse's phone, and one of them will return your call. One of them will get back to you. Again, it's not my way. I'm so glad, and it's the reason I've been here such a long time, is because we really do try to establish a nurse and a patient relationship. This is extremely intimate. And it really is based on a relationship that we, start in the beginning. And there's a lot of tough questions out there. There's a lot of tough situations. This is all really, difficult dynamics. And so it's important that we do create a relationship. Same with your physician. So when you're here for that length of time, you're seeing your doctor the whole time. There's not going to be a resident coming in or a rotating partner coming in. You're seeing your doctor from the beginning of the treatment to your end of your treatment. So that way you've got a nice, consistent relationship. And when it comes to your nurse, again, starting all the way back before you even come to Las Vegas, you're working with me right now, but eventually we're going to have a real working relationship where we're going to be planning out this whole cycle. So you're always going to be talking to Linda, via email or the phone, getting things ready. And that way you don't have to call the other nurse, Susan, and update her on what you talked about with Karen over here. And no, it's always going to be, like I said, you're always going to have, the same individuals to work with. So we try to keep it very homey and cozy, and that's a really big difference with our clinic, and probably why we are very successful at being able to do this kind of long distance IVF preparation, because even at local clinics, people don't have this kind of one-on-one care. So they're often, and again, this is feedback I get from them, they're often out there, by themselves, or not knowing what to do, or not even sure, boy, it seems like when I do call in, I'm bothering people and I'm not even sure when it is okay. I want you to contact me. Informally, we communicate constantly. Either I need stuff from you or you need stuff from me, and we go back and forth so that we are in a constant ongoing relationship. That's what, like I said, that's really what makes it. It's my preferred way of doing nursing, and it's the way the doctors and all the clinical staff have such a good handle on what's going on with you, and vice versa. So that gives you a little bit of an idea how long you're going to be here in Las Vegas, or if you're local here, how long you're going to be busy at the clinic. Now, like I mentioned earlier, you get this little pretty color calendar when you meet with your coordinator, and you can see there's a lot of medications that are started much earlier on. One of the first things, and probably from the get-go, either with the office manager or with the doctor, you're always told that in order to plan these pre-planned cycle dates, you do have to get on a birth control pill. That's how I managed to, get everybody lined up cycle-wise to make these dates work out. So keep this in mind. When you're planning for a cycle, again, whatever cycle date, maybe you've talked with the office manager, with the doctor, whatever cycle date you're interested in, you want to start planning for that cycle about 6 weeks in advance. One of the things we have to do is we have to catch a period, because with that period is when I can start the birth control pill. Oftentimes with that period, the doctor's going to want to get some testing done, some cycle day 3 labs or AMH level or what have you, but I need to catch a period. So in other words, you wouldn't be able to call us on June 1st and say, boy, I'd like to get into that June 17th cycle. No, we're going to want at least about 6 weeks notice, so that way we can help plan, get you on a birth control pill, get testing done, talk about the lab work that needs to be done, get the medications, etc. So again, going back up to the top, plan on at least 6 weeks. Not that I can't try to squeeze you in sooner than that, because I can. Technically, medications, injectable medications, probably only start, probably even less than 3 weeks prior to you coming to Las Vegas. But again, just the idea of getting the medications, getting the testing in order, it can be done shorter than 6 weeks. It's just you find I have to put a little bit more pressure on you to get things done. Now, let's talk about what do we have to get done? What do I have to get in motion to get a cycle started? Well, when you meet with your coordinator for your chart review appointment, besides going over dates, which I just did with you, we have to talk about how we prepare for this. Now, let's talk about, since we're looking at this pretty color calendar here of medications, one of the things you'll talk to your coordinator about is getting your medications. Now, again, oftentimes for my patients who are experienced out there, they have worked with the mail order fertility pharmacies in the past, who is basically who we work with as well. So we will, fax a medication order customized for you to these mail order pharmacies for everything that you need. The pharmacy will contact you for payment and shipping information, insurance information, that kind of thing. And they all generally will overnight these meds to you the next day for free. I tend to order the medications for my patients in advance, not because you need them in advance, but because I like the pharmacy to call you and let you know what's going on, cost-wise, or to check your insurance. I like to get things done so we can all kind of be prepared and get our budget set up. But again, I will order all of the medications you need for the whole cycle. That's how we're going to basically get our medications done. Now, for my patients who don't live in the U.S., live in Canada or outside the U.S., how do we get medications? Well, that is totally doable as well. It's a little trickier, but don't let that frighten you away. I can tell you now, for my Canadian patients or UK patients, or just my patients anywhere around the country, around the world, Usually we start out with trying to get your medications there at home. Because I've had patients from literally all over the world, I've got, some ideas about where we can get medications. Different areas are a little bit more difficult than others. Sometimes I can have U.S. pharmacies send into your country. Sometimes I can't. Sometimes I have to have the Canadian patients have to just barely cross the border to the U.S. to get their medications at a U.S. pharmacy. Like I said, I haven't been stopped yet. There hasn't been a situation where we couldn't figure out the medication. So don't let that scare you. You and I just try to be creative about this and try to save as much money as we can, whichever way we can. But it's completely doable to get the medications as well outside of the U.S. So that's basically how we're going to arrange getting the medications. Pretty easy, pretty basic enough. Now, many of you may find that your doctor has recommended immune therapy in the form of intralipid infusion. Again, might also be some steroids added on or Lovenox injections, and those things are easy enough because that's just part of your medication order. But when it comes to intralipid infusion, again, that's just a hair more work. There are plenty of infusion centers. There's national companies all around the country that do intralipids. And so it's just a matter of finding the one in your area to do the intralipid infusion. Again, even outside the country, I have yet to be stopped or ever had to cancel a cycle. It hasn't had to happen that we couldn't figure out how to get something done. Intralipids is done at a specific time in the preparation of the cycle. Usually it's done pretty much right before you come out to Las Vegas for your cycle. Depending on what your situation is, why you're doing intralipids, everybody will need to have, if you've got immune issues, if the doctor has prescribed this for you, everybody will do intralipids before they come out to Vegas. You will, once we find out you're pregnant, knock on wood, you will be doing intralipids again. Once, maybe more than once, depending on what your diagnosis is for your immune issue. But again, that'll be worked out with your coordinator on how we get that done. We're helping you out the whole way. Now, what else do we have to do to prepare? All right, let's talk about this. Testing. What do I have to do testing-wise? I mean, I'm not even there. Who do I see to do testing where I live? Well, again, for a lot of my patients who have done IVFs before, my biggest request I can make to you is please try to get me your old records, because anything you've done in the last 18 months, I can use. Most IVF clinics, we don't ask for anything fancy. We're not, long-winded about the testing that we need. So more than likely, if you've done IVF, IUIs even in the last 18 months, you have done the testing, semen analysis, infectious disease testing, a couple of hormone tests. Most all of that has been done already. So that's one of the biggest things I can tell you is try as early as you can to get us those records, because I might be able to give you the good news of, you know what, there's either no testing you need to do with us, you've already done everything and I've got copies of it here, or at least minimizing the amount of tests you need to have done. But let's say that's not the situation and we really do need to get all of our testing done. Well, most of what you and your partner have to get done is blood work. And again, what I'll do is I'll do most of my things through email. I'll email you test order forms for both you and your partner. You can take them to any local lab where you live, Lab, or Quest, doesn't matter to me. Any local lab will honor this lab order and tells them right on there to please perform these tests and fax us the results, and there's the lab work done. Other things that become a little bit more complicated, and we need to have a semen analysis perhaps. Again, that's done through labs wherever you live. You might need to call around to find specific labs that do semen analysis, but completely doable. What else? Oh, some kind of uterine assessment. Generally, the doctors prefer to have some kind of a saline ultrasound or what's called a fluid ultrasound or sonohysterogram, all the same thing, where the uterine assessment is done to make sure there's no polyps or fibroids or anything unusual in that uterine cavity prior to an embryo transfer. Now again, can that be done locally? Absolutely. Where are we going to have it done for you locally? Well, I don't know. That depends. There are certainly standalone diagnostic centers that would honor an order from us. There are hospital settings where, again, you can go in and have diagnostic tests done. Maybe you've got an RE or an OBGYN who's willing to help you out with any of the testing you need to get done. So again, haven't had it yet where we couldn't figure out how to do the testing. Just sometimes it's a little bit more homework than other times, depending on the area you live in and how much help you have. But again, completely doable, and I let you know long in advance what kind of testing you have to do to get ready for the cycle. So that's what you and I are working on. We're making sure we get you on a birth control pill. We're making sure we get you out the test orders. Hopefully that's been minimized by the old records that I have from you. We're ordering the medications for you. And we'll have, especially for my folks who haven't had to do the injections and that before, we'll have a specific appointment maybe to go over the medication in detail, to talk about how we're going to do the injections. Again, I have videos online on our website about that as well to help you out, just because I don't like you ever alone not knowing how to do these shots. So I'm always there with you, showing you how to do everything. So that's what's going to happen at our chart review appointment, is we're just going to get questions answered. And I find that oftentimes as I go through, touching base on all these little things, oftentimes my patients usually are very organized. They have their list of questions, and oftentimes I've hit most of those questions as I go through everything. But I want to certainly at that appointment give you an opportunity to ask whatever questions you might have about what we have to get done. Now, I mentioned earlier that there isn't any monitoring that I need you to do during this calendar. However, there is, that everybody will need to get done, there is a baseline ultrasound. Now, a baseline ultrasound and estradiol blood test, this will need to be done for everybody who's getting a medication calendar. We want to make sure before we start up with the fertility drugs, which again happen about a week before you come out to Vegas, at a very specific time, I want you to have a baseline ultrasound done there at home. Simple ultrasound, just to make sure there's no ovarian cysts or anything unusual going on that would slow us down or prevent us from moving forward with fertility drugs. Very rare that something would come up. But even if an ovarian cyst came up, we certainly, if we can just move forward with draining it, and we won't have to miss a beat at all. But again, that is something on your calendar. You'll see, again, generally not difficult to arrange. Could even be something, such a simple OB ultrasound. The OB can do it for you, just to make sure, like I said, the ovaries are quiet. But that is on your medication calendar. Again, it is done at a specific time because it's after the Lupron has started, but yet just about the time that I'm bringing on a fake period once I stop that birth control pill. All part of the timing to make this work out for you. So those are, I think, most of the high points that we're going to talk about at our chart review appointment on how we get prepared for all this and how we get everything done. Now, there are certainly a couple of variations here, a couple of different ways we can go in the type of cycle you're going to do. So let's talk about that, because certainly when I've talked about the timeline of being out here in Vegas for 10 to 12 days, that's kind of what I call a conventional IVF. You're doing a regular old-fashioned IVF, the whole kit and caboodle. But what about if we're not? What about if we're maybe opting to do a cycle where we're going to do some genetic testing, some CGH, array CGH, metaphase CGH, something like that, where we want to test the embryos? In that case, generally you're opting to have what's called a staggered IVF. Now what that means is, because of the way we opt to do our genetic testing, generally we're testing those embryos and we're freezing them as blastocysts. So a transfer is not going to happen in the cycle where the genetic testing is happening, either because the genetic testing may take up to 5 weeks to get the results back, or because we choose to do a biopsy on the embryo when it's at the blastocyst stage. And certainly if that's the case, I wouldn't have the results back in time for a transfer. Either way, we are going to freeze the embryos. So we're only going to do, if you will, the first half of the cycle. So in other words, in that case, you won't be out here in Las Vegas when you're opting to do one of these. You won't be out here for 10 to 12 days. You're only going to be out here for maybe a week. Because after the egg retrieval, you can go ahead and head home. We're going to, again, get the biopsy done, get the genetic testing done. Again, does it take 2 days? Does it take 5 weeks? It all depends on the kind of genetic testing you're opting to do, which your doctor will talk with you about. I will talk with you about in more detail. But what is good to know is, in that kind of staggered cycle where I'm not planning a transfer, well, then your medication calendar is going to look a lot lighter. I'm not going to be giving you any medications geared towards transfer. There won't be any steroids. There won't be any immune treatment like intralipids. There won't be any progesterone. There won't be any of those things, because those are all drugs geared towards a transfer. This will just be about downregulating you with Lupron and ganirelix or Cetrotide, and then eventually stimulating you. And again, you'll get to leave after egg retrieval. Now eventually, because we call this a staggered IVF, you're going to come back for the rest of that IVF. And that, of course, is the frozen embryo transfer portion. That usually is done in the next cycle or 2 cycles away. Again, our frozen embryo transfer cycles are prepared for. You're choosing the cycle date in advance. You're giving us at least 6 weeks notice kind of thing, because they are medicated cycles. You do have to prepare for them. You do have to be on injections for about 3 weeks, but that would be the, if you will, second half of the staggered IVF. So again, if you and I are talking about one of these kind of cycles, we're still going to do everything that we just mentioned. We're still going to prepare for it. We're still going to order medications. Your stay in Las Vegas is just going to be a little bit shorter. You're not going to be on as much medications. So that would be one variation of the conventional IVF. Another variation would be if you're somebody who's actually not stimulating, but maybe you're doing a cycle where you're using an egg donor. You're doing what I might call a recipient cycle. Well, you know what? You're still basically going to be in Las Vegas in that 10 to 12 day kind of stay. Meaning, of course, we're doing most of the monitoring and all of that kind of thing in egg retrieval on your egg donor. But in your case, you're going to be out here in the beginning. I mentioned around 6:17, 6:18, the very start of the cycle. You've been on injectable medications, not the same as the donor, but medications that are geared towards growing a uterine lining, estrogen injections, this kind of thing, immune therapy if necessary. But you're on a nice, pretty 3-week medication calendar like this as well. You'll come out in the beginning, and basically you'll only have 2 appointments with the doctor. You'll have your first appointment to make sure that the estrogen you've been on is done exactly what it's supposed to do, make a nice lining, and you'll just kind of sit and wait. As a matter of fact, if you want it, and I've had some patients do it when they travel, they may travel back home, or they may go take a jaunt over to Grand Canyon or over to Southern California for some fun, because they're not needed back, at least she's not needed back, until the time of embryo transfer, which again is probably about 10 days away. So she's got a nice big 10-day break. Now, what comes in the middle of that 10 days, though, is an egg retrieval for the donor, and of course we need the partner at that point. So whether if you're using donor sperm, it's different, certainly, but if you have a partner, the partner will be available, have to be available to give his sample during that egg retrieval. And then, of course, embryo transfers, as I described it earlier. But still, again, you're in a medicated cycle like this. Again, all of the medications that I talk about with you are on the injection instruction video. So you're also got me holding your hand while you're learning all your shots. Preparation for the cycle, again, is roughly the same. Sometimes there's a little bit more extensive testing if you're over 40 or over 45 that we want to get done. We have no problem getting you pregnant, and we know we're going to have a very good chance of getting you pregnant. We just want to make sure you're going to be healthy and pregnant. So you'll find that sometimes I have some extra testing the doctors will want to get you done to get ready for the cycle. All right, so in summary, let's see, what did we talk about today? We talked about cycle dates, so you guys can get a better handle on what it means to choose a cycle date. We talked about your length of time that you'll be either busy here in Las Vegas for those who have to travel here, or how long you have to cut away from your life if you live here. We talked about how we're going to get the medications using pharmacies. Certainly you guys have input into that. We talked about testing and trying to get your old records here, that kind of thing. Those are all of the nuts and bolts, if you will, of a real chart review appointment that you'll have to get ready for the cycle. What else? Certainly coming to Las Vegas for those who have to travel here. We have some extended stay hotels. I think they're on our website too, that you guys can get an idea where some discounts. We might be able to, if you mention our name, you can get a better price. Again, you're here for 10 or 12 days, so sometimes extended stay and having a little kitchen is kind of nice. Refrigerator for those meds, of course, but you're in Las Vegas. So that means that you've got the whole strip, you've got there's plenty of places to stay and lots of good deals out there. What else about Las Vegas? One thing that I'll probably tell you for those who are traveling here, you're going to want to commit to getting a rental car. We're not really good here about public transportation, and there really isn't any hotels that are right within walking distance of the clinic. Plus you find you've got to come back to the clinic sometimes a couple of times a day for a blood draw and then an ultrasound. So renting a car is really the way to go. The strip is probably about 5 miles away from us, straight shot down. So that's not anything that's difficult to get to. And certainly there's plenty of things to do here. And the weather is either just pretty darn calm and pleasant, or just if it's the summer, it's just pretty darn hot. So you're going to want to pool. Otherwise, I think that's about it for now. Come back, please, and visit this video over and over again, even if you're doing coordination. It's going to help for you to remind yourself how a cycle works. This video is done for you guys to show that I'm always there whenever you need me, so you guys can keep playing me all the time. You'll get really tired of my voice. I should play this and make my husband listen to it all the time. That would really torture him. Otherwise, we're going to talk and we're going to communicate and we're going to email, and you're never going to be alone for a cycle. All right, that's the important thing. All right, we'll talk to you guys soon. Bye.